Fish oil is one of the most widely purchased supplements in the world. Billions of capsules are consumed daily. But should seniors specifically be taking it? What does the science actually say, and how much and which type? The answer is more nuanced than most supplement marketing suggests, but also more positive than the skeptics claim. Today we're covering what fish oil genuinely does, what the recent large trials showed, and how to use it effectively if you choose to. Fish oil is rich in two specific omega-3 fatty acids, EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid. These are long-chain omega-3s with direct biological activity. They are incorporated into cell membranes throughout the body, affecting how cells communicate and respond to inflammatory signals. EPA is primarily responsible for anti-inflammatory effects. It competes with inflammatory omega-6 fatty acids for the same enzymatic pathways. DHA is the primary structural omega-3 in the brain. It makes up a substantial proportion of the brain's gray matter and is critical for neuronal membrane function, synaptic transmission, and cognitive performance. The body can technically make small amounts of EPA and DHA from alpha-linolenic acid, found in flaxseed and walnuts, but conversion is extremely inefficient. Direct dietary sources of EPA and DHA are far more effective. The cardiovascular evidence for fish oil has been one of the most debated areas in nutrition science in recent years, because large trials have produced contradictory results. The VITAL trial, 2019. A large, well-designed, randomized controlled trial of 25,000 participants found that fish oil at 1 gram of EPA plus DHA daily reduced the risk of major cardiovascular events by 28% in people who rarely ate fish, and by significantly more in African American participants. The REDUCE-IT trial tested a very high dose of purified EPA, 4 grams daily of eicosapentaenoic acid, prescription Vascepa, in people with elevated triglycerides, found a 25% reduction in cardiovascular events. This is a pharmaceutical-grade prescription product, not standard fish oil. Standard fish oil at 1 to 2 grams modestly reduces triglycerides, typically by 10 to 30%, which is clinically meaningful. Effects on overall cardiovascular events at this dose are less consistent. Bottom line for seniors: fish oil has clear triglyceride-lowering benefits and meaningful cardiovascular protection, particularly for those with elevated triglycerides or who eat little fish. The very high-dose prescription EPA product is specifically indicated for high cardiovascular risk. The brain is 60% fat, and DHA is its most abundant omega-3. Brain DHA levels decline with age, and low DHA is associated with cognitive decline and dementia risk. Observational evidence: people who regularly eat oily fish consistently show lower rates of cognitive decline and dementia in large population studies. Intervention trials: results are more mixed. Fish oil supplementation appears to slow cognitive decline in people who are already mildly deficient, but has less clear benefit in people with already adequate omega-3 status. The Mindex trial and other studies in older adults with mild cognitive impairment show that DHA supplementation slows brain atrophy and cognitive decline when started early. Bottom line: for seniors with low fish consumption or low omega-3 status, DHA supplementation has plausible and increasingly supported benefits for brain health. Starting earlier rather than later appears to matter. Joints: multiple clinical trials show that EPA and DHA reduce joint pain, morning stiffness, and anti-inflammatory medication requirements in rheumatoid arthritis. Effects in osteoarthritis are more modest but present. Eye health: DHA is a structural component of the retina. Several studies show that omega-3 intake is associated with reduced risk of age-related macular degeneration, the leading cause of vision loss in older adults. Mood and depression: EPA specifically has been shown in multiple trials to reduce depressive symptoms, with an effect size comparable to antidepressants in some studies. Fish oil is increasingly considered a genuine adjunct treatment for depression. Dry eye syndrome: multiple trials show fish oil reduces dry eye symptoms and improves tear quality, a common complaint in older adults, particularly women. Inflammation: broadly, fish oil reduces circulating inflammatory markers, including CRP and interleukin-6, relevant across virtually all age-related disease. Not all fish oil products are equal. Here's what matters: EPA and DHA content. The label should specify milligrams of EPA and DHA, not just total fish oil. A standard 1,000 mg capsule may contain only 300 mg of actual EPA plus DHA. Look for products where EPA plus DHA totals at least 500 to 1,000 mg per serving. Triglyceride form vs. ethyl ester form. Triglyceride form fish oil is better absorbed, up to 70% more bioavailable. Some premium brands specify this. It costs more but less is needed. Freshness. Fish oil oxidizes easily, producing a rancid product that may actually be pro-inflammatory. Choose products with a clear manufacturing date and expiry. Refrigerate after opening. If your capsules smell strongly fishy when cut open, they may be oxidized. Dose: 1 to 2 grams of combined EPA plus DHA daily is appropriate for general health support. Higher doses, 3 to 4 grams, are used for specific conditions like elevated triglycerides, joint disease, or depression. Take with food. Absorption is substantially higher when fish oil is taken with a meal containing fat. Note on blood thinning. Fish oil has mild antiplatelet effects. If you take warfarin, aspirin, or other blood thinners, discuss fish oil with your doctor before starting. Fish oil is one of the most well-studied supplements available, with genuine benefits across cardiovascular risk, triglyceride reduction, joint health, brain function, and mood. The evidence is not uniformly positive at all doses and for all outcomes, but for most older adults, particularly those who eat little oily fish, supplementing EPA and DHA is a well-supported choice. 2 servings of oily fish per week. Salmon, sardines, mackerel, or trout provides sufficient omega-3 for most people and is the preferred approach. Where diet falls short, a quality fish oil supplement is a reasonable addition. As always, consult with your doctor before adding supplements, particularly if you're on anticoagulant medications. See you in the next video.